promised them we would talk a little bit about the studies. It's IEP season.
Absolutely.
There are lots of things that are out there that illustrate clearly that ABA is effective, but they show different kinds of things. What kinds of things are out there, and tell us specific studies, so if a parent needs to go in armed with something, they have the possibility of doing it.
Absolutely. Well, the first classic one is the LOVAS study that was published in 1987, and it showed very clearly that children who received 40 hours a week of one-to-one ABA intervention far outperformed children who received either 10 hours a week of ABA or children who received 10 hours a week of just sort of treatment as usual. So that very clearly showed 40 hours works great, produces huge outcomes, 10 hours, not so much.
Okay, so really important, because a lot of people right now are getting doled out 10 hours.
Absolutely, yeah. In fact, we have several of our offices, the funding agencies in those local areas, that's about all they give.
Right.
And in fact, they even try to pull this kind of thing with us sometimes, where they'll approach us and they'll say, we promise to refer you at least X number of clients as long as you only recommend 10 hours a week.
Right.
And of course, we always say, forget it. You know, it's not going to happen, because it's not, that recommendation, 10 hours a week, is not based on the research. If the child has a diagnosis of an ASD, either autism or PDD-NOS, and that child is under the age of 5 or so, that's just not a research-based recommendation.
Right, and for parents who just heard that and they're with somebody else, you need to realize that that's a very real thing, and you can switch providers.
Absolutely, yeah.
And we'll talk about that when later on in the hour when we don't have you, and I'll give some things about that. But you can switch providers, and
you can push for more hours with your current provider. You can push your provider to recommend that.
Absolutely. Okay, so first one showing us that really level of intensity has got to be there. Okay, then what are some other studies that are out there? What do they show?
Well, a lot of folks have sort of complained that, the original LOVAS study was never replicated, and we're not really sure that there's so much research showing, really showing that intensive ABA is needed, and that's just simply not true anymore.
Or as I like to say, that's a big steaming pile of poo.
All right. Exactly.
But they will say that to you in an IEP because people think that because somebody else told them. It's a big steaming pile of poo.
Right. That's exactly.
That's the technical term for it.
Yeah. So starting in about 2005, several other studies on intensive ABA started to come out that showed very, very robust treatment effects. And so a great one to be aware of is by Glenn Sallows and Tamlin Gropner, Sallows and Gropner, 2005. And they did 30-something hours per week for 4 years. And what they showed was continued progress across all 4 years. And so what that showed was intensive services are necessary, and they produce a large increase in IQ scores and other measures as well, but also that those treatment effects continue over time. So they saw the largest gains in the first year or two of treatment, but they still saw gains in year 3 and gains in year 4. So it's not just the intensity of treatment, it's also the overall duration of treatment. So if your child has been in an ABA program for, let's say, 1 to 2 years, and is still under the age of, let's say, 7 or 8 or so, and is still making progress, if you hear something like, well, ABA really isn't needed for more than about 2 years or so, that also is not a research-based recommendation. So the Sallows and Gropner study showed continued gains in year 3 and year 4.
Okay, great. And there are lots of people who are having to argue that right now.
Absolutely.
Because what people are doing in different funding agencies is saying, oh, we're only funding 2 years, or oh, we're only funding 3 years, but you can fight it and win, and people who do fight do win.
That's exactly right. Yeah. And all right, and so then another complaint you sometimes hear is the ABA research is done in only university settings, and so maybe you can get results like that when you have, let's say an expert like Lovas or Glenn Sallows at a university supervising the treatment, but that it's not realistic to implement in the community. Well, in 2006, Cohen and colleagues published a study that specifically evaluated that. So they looked at intensive ABA services provided by community-based treatment providers, so providers like CARD. We weren't in the study, but other community-based providers. So there was no university involvement with the study at all. It was a real-life treatment evaluation. And what they found was very robust treatment effects. In fact, in some ways, even outperformed the Lovaas study. And so they showed very clearly, yes, indeed, as long as the quality of the treatment is high, ABA services can be implemented with great efficacy by real-life, everyday service providers, not just in university settings. So that was another study, and it was, I think they did 30 to 40 hours a week.
Okay.
And so that's another one to be aware of, Cohen and colleagues in 2006.
Okay. We should mention, because we're going to talk about some more studies, that if you're going into an IEP and you need to get access to these studies, you can search for them, but if you need help, you can email me and we will help you to get access to these studies.
Yeah, we're able to help folks find the articles.
We can show you exactly, email me and we can do that. Okay, so Cohen, but now, and there are others as well.
Oh yeah, lots. Okay, so that was Cohen.
I love this. This is so exciting. Okay.
That was Cohen, 2006. Another common sort of misconception is that ABA is only appropriate for very, very, very early intervention. And so, so let's say you are unfortunate enough to not get your child diagnosed and access services till he's a little bit older, let's say maybe 4 or 5 or even 6 years old.
Right.
A study was published in 2007 by Sven Eikeseth, one of the top ABA researchers for kids with autism out of Norway. And what they did was they evaluated the effectiveness of center-based ABA programs for children who were between the ages of 4 and 7 at intake.
Okay.
So between 4 and 7 when ABA began, they did intensive ABA about 30 hours a week for 2.5 years. And they compared the outcomes of those children to children who received the same amount, the same number of hours of services, but using sort of a treatment-as-usual, eclectic special education approach. And what they found was there was a huge difference in outcomes, and the kids who were in the ABA group really made substantial progress, even though they started treatment, a couple years later than we know is optimal.
Right.
So that was Sven Eikeseth and colleagues in 2007.
Because we're going to talk more about this and what that means in terms of FAPE, IEP when you're not here, because I'll talk about that. But really important, because if they're offering you this and saying, well, this is what we have, that's not what the law says. We'll talk more about that later. Okay, but remember that, placeholder. Okay.
Another study from 2006, also by the same group in Norway, was by Sigmund Eldevik and colleagues, 2006. And what he looked at was the effectiveness of low-intensity ABA services. And so he had a group of kids that was receiving approximately 12 hours a week for a couple years or so. And what they found was the results of treatment, the effect size was statistically significant, which means it wasn't just due to random, chance that the kids gained something, but the authors thought probably not clinically significant, which means they made some gains, and it was better than nothing, but nowhere near the same effect that you get with intensive treatment. So the two main studies to remember for treatment intensity are the Lovaas, 1987, that compared 10 hours to 40 hours and showed that 10 hours was not good enough. And then the Eldevik 2006 study. And that looked at 12 hours and showed that really 12 hours wasn't good enough. It's
better than nothing. But it's not going to get you there. It's not going to get you where you need to get. Really important. Anything else that we should know going into an IEP?
Sure, there's lots.
I love this. It's like a wealth. There's a wellspring here. Okay, cool.
Let's see. Jane Howard published a study in 2005, and that evaluated the effectiveness of home-based ABA intervention in the Central Valley region of California, and that was also provided by a community-based service provider. And I think they did about 30 or so, 32 hours a week, and they compared their outcomes also to a group that was getting the sort of the top special ed program in that region. And they had actually collaborated with the public school district and the regional centers to identify what the special education officials considered sort of a best practices program in the school. And they wanted to compare outcomes between that program and an ABA program. And so the kids got about the same number of hours per week, about 30 or so hours per week, and the same level of intensity in terms of one-to-one. So the kids in the special ed program were getting one-to-one, and the kids kids in the ABA program were getting one-to-one, and for the same duration. So when you think about it, they cost about the same amount.
Right.
Okay, and the intensity was the same. The difference was the type of treatment they were getting. Now, eclectic special ed is sort of the most common approach to special ed for kids with autism in our country and probably in the world today. And what it is a mix of a little bit of everything.
Right.
And so the rationale there is each kid is different. We don't know what treatment's best, so we're going to do everything a little bit.
Right.
So a teeny bit of ABA, which basically means a little bit of discrete trial here and there, a little bit of the teach model, maybe a little bit of floor time, a little bit of, PECs, maybe a little bit of speech and OT, and, just kind of a mixed bag. Just kind of throw a little bit of everything in there.
Right.
And try to keep the kids happy, basically.
Right.
And so they compared the outcome of that, eclectic special ed, to intensive ABA, and no surprise, the ABA group outperformed the special ed group considerably. And in fact, some of the kids in the special ed group appeared to actually get worse in terms of their standardized scores.
That's really what won it for us, so that we got to have ABA at home, because I said, show me a study that what you're going to do is effective, and they
got it. Well,
couldn't.
So that brings me to my next study, which is another one by Sigmund Eldevic, great researcher. This was actually, I believe this was actually his dissertation that he did in graduate school in Norway. And what he did was he evaluated the effectiveness of a publicly provided ABA program that's intensive ABA in public school classrooms, but run by experts in ABA, with a high level of involvement of PhD and master's level ABA experts. And so they're the ones that ran the program. And they compared it to a group that got, again, just sort of eclectic business as usual, special education, and again found very substantial treatment effects. And so what that shows is public schools could actually be doing it properly within their own classrooms. They could be implementing effective evidence-based intensive ABA. The problem is, the way it's usually done is they'll hire one BCBA, and that person's in charge of maybe 60 kids or 100 kids in the school district, and it's impossible for them to do a good job. And they'll hire, paraprofessionals for, I don't know, $9 an hour, $12 an hour, with no real training. Maybe they'll give them a 6-hour in-service and expect them to be able to do everything, and ABA is not easy to do. It takes a lot of training, a lot of supervision. And so this study was a nice demonstration in Norway of if the public schools allocate the right resources in terms of actually having enough experts in ABA to supervise the kids program and to train all the therapists or one-to-ones, whatever you want to call them, you can actually pull it off, and it can be done well.
Good to know.
So yeah, that's interesting.
It's where we got to get to.
Yeah, that's right.
Exactly. How are we doing time-wise? We're going to have to let you go in a minute. Anything else you got for us?
Well, yes, there's always more. One thing that's good for folks to be aware of is when people publish review papers. A review paper is a project where you don't do any research yourself, but you systematically look at other people's research and you write up a summary, basically, of what other people found. So your average person who's not a researcher picks up an ABA research article, or frankly any research article, in a peer-reviewed journal, and it's just kind of Greek. It just doesn't really make sense. It's overly technical. It's hard to read. Review papers tend to be more broad in scope and written in more consumable language, and so they can be very, very effective at educating you and teaching you about what evidence really exists, and then also bringing it to IEP meetings. So there's probably 5 different really good review papers that have been published in the last few years. One is by Eldevic, same guy, Sigmund Eldevic. That was in 2009. Another one was by another Norwegian, Sven Eikeseth, and that was also 2009 in a different journal.
Love these names, too.
Yeah, right?
They all sound like ice skaters, speed skaters.
Yeah, right. Or Olympic athletes.
Yes, exactly.
Well, they are sort of the Olympians of ABA research.
There we go.
They're very, very good. Let's see. And then there's one by Brian Reichow. He's at Yale. And that's a great review paper. I believe that was 2009 or so. And then he published a review paper of review papers in 2011. And that was actually really useful, too, because basically what it showed was if you're reviewing ABA research in a rational way where you actually understand how it's done, consistently you find real clear treatment effects. There was one review paper, and I'm blanking on the name right now, that was published that basically found no real legitimate evidence for ABA. It doesn't work, And when you go and you look back at how they actually evaluated the studies, they evaluated the Glenn Sallow study from 2005 that had 2 different groups of participants. Both of them were getting 30 or more hours per week, I think 35 or so hours per week. And there was no difference in outcome between those 2, which you and I would say, well, yeah, of course, they're both getting intensive ABA supervised by experts. And the person publishing this erroneous review paper interpreted that as no difference between treatment and control group, and so therefore ABA is not effective. Yeah, it's really, it was like, it's a real bird brain move, but I don't know, I guess they didn't know what they're doing. So now Reichow published a review paper of review papers in 2011 and sort of cleared up that mess.
Okay.
So there's lots of good review papers, and if your audience would, again, like to know, get access to those, we can certainly help them track down those articles.
Okay.